Hello friends, welcome back in another video tutorial. This is going to be the part 3 of Staphylococcus aureus treatment videos. So in that previous video we have discovered a new type of antibiotic, that is methicillin, right? But unfortunately Staphylococcus aureus again adapt itself and learned to express a new kind of gene called MEK. This MEK will give rise to a particular type of modified PBP, right, which remains ineffective, or in this modified type of PBP remain unaffected by in presence of any kind of older antibiotics that we have discussed until now. That means I mean about penicillin, methicillin, etc. Okay, so under such circumstances, those kind of strains we named those kind of strains as MRSA, that is methicillin resistant Staphylococcus aureus. Okay, so under such circumstances, as they have now changed their penicillin binding protein, it was clear that we cannot use beta lactams, right? So under such circumstances, scientists thought to now move on to another class of antibiotic. Okay, so they move for glycopeptides. An example of glycopeptides is vancomycin. So I do not going to discuss about mode of action of vancomycin here. We have already conducted a lecture on mode of action of vancomycin, that is our cell wall synthesis inhibitor video. So if you want to learn about what is the mechanism of action of vancomycin, then I would like to recommend you to go and watch this video, then you can understand. Okay, so scientists thought that they can use vancomycin for treating MRSA, but again, making the matter more worse, Staphylococcal aureus again adapt itself. Okay, although vancomycin have some serious side effects, along with that Staphylococcus aureus also adapt itself to make them resistant to vancomycin. Okay, so there are two kind of resistance that they develop. One is intermediate resistance. Those kind of strain who have developed this intermediate resistance are known as VISA. That is not the VISA we usually know, but it is the vancomycin resistant intermediate Staphylococcus aureus, and some of the strains develop a complete resistance, okay, known as some of the strain have also developed complete resistance called vancomycin resistant Staphylococcus aureus, okay, known as VRSA. So we have here learnt about two kind of strain. One is VISA, another one is VRSA. VISA is intermediate strain, another VRSA is the complete resistance strain. Okay, now let's move to the next one. So we have to again search for new antibiotic and vaccine to treat Staphylococcus aureus. Although the overuse of antibiotic make rapid resistance an ongoing problem. That means whatever we will going to use, it will develop a resistance against that particular type of antibiotic, right? So under such circumstances, nowadays Staphylococcus aureus infection are treated by testing the bacteria against a handful antibiotics, and then we will look for which kind of antibiotic works appropriately for them. Okay, so some of the hospitals also uses antibiogram. Okay, so this antibiogram help you to understand which of the antibiotics are frequently resistant to that particular bacteria. So what is antibiogram? Let us discuss. So antibiogram, so I have taken this picture from SlideShare, so you can also get that entire PDF from SlideShare, that is available in Google. So antibiogram is a laboratory test used to determine the sensitivity pattern of a given microorganism to a range of antibiotic. That means in simpler words, you know what, we are testing the bacteria against a wide range of antibiotic and trying to find out which antibiotic will work well against that particular microorganism. Okay, so up to that part we have learned that in first we are using penicillin, right, at very first initial level of Staphylococcus aureus infection. Then we have find out that most of the Staphylococcus strain have developed a ability to produce beta lactamase. This beta lactamase have the ability to break down the beta lactam ring, and as a result most of the penicillin become inactive, right? Under such circumstances we have find out beta lactam inhibitor known as clavulanic acid. Okay, so now when Staphylococcus aureus have developed resistance to penicillin, we have developed a new kind of antibiotic, that is methicillin. Okay, so now under such circumstances Staphylococcus aureus learned to express a new kind of gene known as MEK. Okay, this gene will lead to the production of a special type of protein known as modified penicillin binding protein, and as a result no beta lactam antibiotic that we have discussed until now remain effective against these strains of Staphylococcus aureus, and these particular strains are called MRSA. Okay, and from now MRSA, for as they have now modified the penicillin binding protein, so we have to choose something new. So under such circumstances we decided to use vancomycin. Okay, so this vancomycin will remain effective against MRSA. Okay, but under such circumstances Staphylococcus aureus again develop a resistance. This resistance are of two types. One is intermediate resistance and another one is complete resistance. So intermediate resistance is VISA and complete resistance is VRSA. Okay, so now what to do? So nowadays we are using, or we are simply testing various type of handful antibiotics against a particular type of microorganism. Okay, to find out which antibiotic will work well against that particular microorganism, and we are also using antibiogram for finding out which microorganism will be useful. Okay, and usually for treating MRSA we are using liндamycin or vancomycin, but alternatives also used. We can use tetracycline, trimethoprim, daptomycin, quinupristin, dalfopristin, tigecycline, linezolid and sulfomethoxazole as alternatives. So that's it for the treatment of Staphylococcus aureus. So we have learned that first we are using penicillin for treating Staphylococcus aureus, but Staphylococcus aureus adapted quickly and learned to produce a special type of enzyme called beta lactamase. This beta lactamase destroys the beta lactam ring. As a result, penicillin remain ineffective. Okay, under such circumstances we have also developed clavulanic acid. This clavulanic acid is the inhibitor of the beta lactamase enzyme, and as a result penicillin can now show its action. Under such circumstances we have also find out a new type of antibiotic, that is methicillin. So Staphylococcus aureus also develop a new type of resistance by learning to express MEK gene. This MEK gene will produce a special type of penicillin binding protein that remain ineffective or unaffected against or in presence of all the other kind of beta lactams that we have discussed until now. So under such circumstances it was now necessary to change the antibiotic class. So we have changed the antibiotic class and now we are using glycopeptides. Okay, mainly the vancomycin. Okay, so under such circumstances Staphylococcus aureus have again developed resistance, and this time they have developed two kind of resistance. One is VISA, another one is VRSA. Okay, so under such circumstances nowadays scientists use to test the microorganism against a handful of antibiotics, and we are trying to find out which antibiotic will be useful for that particular type of microorganism. Sometimes we are also using antibiogram for that purpose, and most of the cases when we are treating MRSA we use liндamycin, vancomycin, but alternatives also include tetracycline, trimethoprim, tigecycline, zinezorin, sulfomethoxazole, daptomycin, quinupristin, and dalfopristin.